I am Dr. Rafdzah from the Department of Social and Preventive Medicine, Faculty of Medicine, Universiti of Malaya. In this module, I will introduce various methods that can be used to carry out epidemiological investigation. At the end of the session, you will learn how to use and justify classical epidemiologic method in study design, data analysis, and interpretation of results. I will divide my lecture into 4 parts. First part will be on descriptive epidemiology. Second part on observational study, followed by experimental study, and finally, I will cover errors in epidemiological studies. When describing health or disease event in population, many questions need to be answered. What is the problem of disease? Who is affected? And how they get the disease? For example, we want to know what is the most common vector-borne disease in Malaysia. Or we want to know what is the most common cause of death in Malaysia. We want to know the distribution and determinants of health and diseases and disease outcome in population. Outcomes can be morbidity, injuries, disability, and mortality. So what we need is epidemiology. By definition, epidemiology is the study of the distribution and determinants of disease frequency in human population and the application of this study to control health problem. Disease frequency will answer how many affected by certain disease or cases count, whereas disease distribution will answer question of who, when, and where. Information on frequency, distribution, and other factors will generate hypotheses about determinants or what can possibly cause certain disease or health problem. A determinant is a characteristic that influences whether or not disease will occur. In general, the frequency of a problem, which can be any outcome of health event, is a fraction, where the numerator is the number of people experiencing the problem over the number of people in whom the problem could occur, or the denominator. The two common measures of frequency in epidemiology are prevalence and incidence. Prevalence is the proportion of a defined group or population that has a clinical condition or outcome at a given point in time. Or simply, prevalence is the number of cases observed at time t divided by the total number of individuals or population at time t. For example, if you have 100 patients hospitalized with stroke and 18 of them had intracranial hemorrhage, the prevalence of intracranial hemorrhage among hospitalized stroke patients is 18/100, or 18%. Data from cross-sectional study or survey will provide information on prevalence. For example, the third Malaysian National Health and Mobility Survey in year 2011 found that 32.7% of adults aged 18 years and above have hypertension, and 15.2% of adults aged 18 years and above have diabetes. Next is incidence. Incidence is the number of new events over the number of persons at risk of the event at the beginning of the time period. There are two types of incidence rate. First is cumulative incidence rate. Cumulative incidence rate is the number of newly diseased individuals for a specific time period over total number of population at risk for the same time period. Cumulative incidence rate is a measure of average risk. Cumulative incidence rate also answers the question, what is the probability or chance that an individual develops the outcome over time, and referred to as the risk or event rate. Next is incidence density rate. Incidence density rate is the speed at which a defined at-risk group or population develops a new clinical condition or outcome over a given time period. The denominator is person time or population time. Incidence density rate answers the question at what rate are new cases of disease occurring in the population. For example, we follow 6 persons diagnosed with breast cancer for 6 years from 2003 to 2009. Our outcome of interest is death due to cancer. At the end of 2009, 3 persons died. 1 in 2004, 1 in 2006, and 1 in 2007. The cumulative incidence rate is 3 out of 6 or equal to 50%. So, the average risk of breast cancer patient died within 6 years is 50%. To calculate incidence density rate, we need to know the total person years. In this case, person 1 we follow for 3 years, person 2 for 4 years, person 3 for 6 years, person 4 for 3 years, person 5 for 1 year, and person 6 for 5 years. So total is 22 person years. So the incidence density rate is 3 over 22 or equal to 0.15 or 14 cases over 100 person years. This means if we follow 100 breast cancer patients for 1 year, 14 will die. Or if we follow 50 breast cancer patients, 7 will die in 1 year. Now I will talk about descriptive epidemiology. Descriptive epidemiology describes patterns or disease by person, place, and time. We are interested to know who is getting the disease. For example, what is their age, sex, religion, race, educational level, and etc. When disease affects certain kind of person at the same time and in the same place as other person who are not affected, this provides clues to the cause and guidance on how healthcare effort should be deployed. In epidemiology, it is also important to know about where any particular disease is occurring. The geographical distribution of cases indicates where a disease causes a greater or less burden of suffering and provide clues to its causes. When a disease is limited to certain places, the disease is called endemic. This figure shows higher prevalence of adult HIV in Africa region compared to other region. Epidemic is an outbreak or unusually high occurrence of a disease or illness in a population or area in a particular time. Epidemic involve concentration of new cases in a particular time. The term pandemic is used when a disease is especially widespread, such as global epidemic. The existence of an epidemic is recognized by an epidemic curve. This is epidemic curve, where y-axis is the number of cases plotted against time in the x-axis. The distribution of cases can be used to generate hypotheses on the nature of the disease, such as its incubation period and its modes of transmission. In summary, clinical decision-making relies heavily on counts and probability. Information on the frequency of events forms the basis of clinical epidemiology. Finally, frequency and distribution provide valuable information about what to expect in different clinical situations and provide important guide to plan health services or allocate resources.